My name is Dave Hardinger. I'm a physician assistant. I work with the Joint Replacement Program at Reading Hospital, and today we're going to be talking about avoiding postoperative complications. Anytime a patient has surgery, there is always a risk of potential complications for the first few months following surgery. One of these is DVT, or deep vein thrombosis. This is a clot which forms in the calf veins and carries the risk of moving and going to the lungs, which causes another problem known as a pulmonary embolus. DVT is usually diagnosed by a clinician when the patient presents with calf tenderness and swelling, which won't resolve after elevation and rest. If a patient is having these symptoms, they should contact their surgeon or family physician. A pulmonary embolus usually presents as sudden onset of chest pain, shortness of breath, anxiety, a feeling of dread, and this is considered a medical emergency. If a patient is experiencing these symptoms, they should immediately call 911 and come to the emergency department. Staying well hydrated and being active are keys to preventing blood clots. Patients following surgery should get up at least once an hour during the daylight hours, and using their walker, crutches, cane, should go for a short walk to stay active. In addition to staying active by getting up and moving around while you're at rest, you can do what are called ankle pumps, keeping your ankles moving. Your physical therapist will demonstrate this to you in the hospital and explain to you how to perform this activity. Blood thinners are medications that are used to prevent DVT and are used in almost all patients. The most commonly used blood thinners today in our program are aspirin, Eliquis, Lovenox, and Xarelto. Patients are on blood thinners immediately following surgery and will stay on them for several weeks to a month following surgery, depending on the particular blood thinner. The postoperative dressing is usually left in place for 3 to 5 days and will instruct you on follow-up care at your time of discharge. When the dressing is removed, there are small tape strips called steri-strips which cover the wound, and they're left in place. It is common, however, for the wound to become ecchymotic, black and blue, and also to swell over the course of the first few weeks following surgery. Ice and elevation are important and keys to helping prevent swelling. If the swelling is kept under control, pain is usually lessened. Typically, it's good to elevate on a pillow, and we'll give you some specific instructions during your hospital stay as to how to properly elevate your leg. Once the original surgical dressing has been removed, it's all right to get the wound wet in the shower, typically after the 3rd day. It is not necessary to put any antibiotic creams or lotions on the wound. Nothing typically is applied other than a dry, sterile dressing at this point. If you suspect there are any problems with your surgical wound, it is better to contact your surgeon to have him evaluate the wound. Surgical wounds today typically are closed with glue, although some of the surgeons still do prefer sutures and staples. Sutures and staples are typically removed at about 14 days postoperatively. It takes 6 weeks before the scar tissue that forms at your wound is mature, and it takes fully 1 year for a surgical wound to be completely healed. The scar from a postoperative wound should be protected for about 1 year from sun exposure with sunscreen, although we recommend not starting that until the 4th or 6th week following surgery. Overall, the risk of complications following joint replacement surgery is very low. However, it is prudent to be aware of these potential complications and to notify your surgeon if you have any concerns. Our goal is to help you on the way to a speedy recovery and to return you to your active lifestyle.